Hey everybody, this is Sunny. Thanks for joining me once again on We Live Here, We Love Here, We Work Here on Sold by Sunny, Buy with Confidence, Sell with Success. I'm here today with Ben, and Ben, thank you so much for joining me. Ben is a physical therapist at Hulse Jepson. You have a lot of locations all around the area, right?
I do, or we do. We have 22 locations plus an at-home division, so we can try to meet and serve your needs.
Yeah, so we're particularly at the one in Granville today. Ben, again, is a physical therapist. Ben, I know a lot of people go to physical therapy, but then a lot of people don't understand it. What's the actual premise of physical therapy? If I hurt, why do I want to come and do all kinds of things?
Right. So the whole goal of physical therapy is to restore function and bring you back to where you need to be. So yes, sometimes that will get better on its own, and that is kind of our mindset a lot of times. That hey, I'll just let it get better. I'll see if I can do it. But
Usually doesn't work.
right, PT can absolutely expedite that process. Can make you feel better a lot quicker. So and we can treat everything from your simple aches and pains to post surgery to like, hey, I have vestibular issues and or concussion issues, and people don't know we do that stuff. So
And you do dry needling and cupping and
yep.
things as well,
Yep.
correct?
So we do dry needling, we do cupping, I do blood flow restriction. I'm actually working on getting a diagnostic ultrasound
Oh,
certification to be
wow.
able to
Oh.
determine if you have a tear or a rip or something like that. So yeah, we do a whole bunch of stuff. Physical therapists are the musculoskeletal experts. Yeah.
I believe musculoskeletal experts. That's who you want to go to instead of staying at home. I know that you see all types of different injuries and you help all different types of people. You, in fact, were my physical therapist when I had my rotator cuff surgery. Um, Ben, what do you see the most of? What's the biggest or the largest amount of injuries, the types of injuries that you see?
Low back pain in America is pretty much the most common. They say about 50% of people will have some episode of low back pain within a 5-year period. So and that can be the most debilitating. It takes the biggest toll on the economic. People are missing work and stuff like that.
I can
So
relate.
yes, so that's probably really the bread and butter. But then it becomes shoulders, knees, ankles. I treat a fair amount of athletes too. So in Granville we have the high school right down the road. So I'll
Okay.
get the football players, the lacrosse, the everything under the sun.
Cheerleaders, all
So
of them, yeah.
cheerleaders, every single sport possible. So yeah, it's a little bit of everything, and that's what makes this job fun. Is I can go from treating someone who's got a back, some back pain, to someone who has jaw pain, to someone who rolled their ankle, to someone who had a knee replacement, all within a couple-hour period. So
That's a lot. That's a wide range of injuries, which must include a wide range of education.
yep.
I've been told that nowadays it's as hard, if not harder, to get into physical therapy school than to get into a doctorate program.
Yep.
So tell me about the education that a physical therapist needs to become a physical therapist.
So in 2016, I believe it is, that they switched to a DPT, or a doctorate of physical therapy, as the standard of care for education now. So it is however many years it takes to get your bachelor. So for me, that was 4 years. And then I went to Grand Valley for my DPT, and that was an initial 3 years. So 7 years total.
Okay.
After that, you continue with continued education. So, like I said, I'm working on a diagnostic ultrasound thing right now. And going through and just kind of work on that. So every couple of years, you have to prove that you still know your education. You have to get your CEUs. That's common in other professions, but yeah,
very common in real estate every year.
We continue doing that.
So if you're planning on becoming a physical therapist, number one, do well in school and study hard, and then number two, don't plan on just being a quick 4-year fix. It's a 7-year. It's an investment in time and money.
A lifelong learner is what we tell people. So,
and when you're working with people, I know you're very you're a lot of fun to be with, and you're very communicative, you're very animated. What's your most favorite, and this sounds kind of odd, but favorite type of patient as far as injury wise? What's the most challenging?
So the most challenging, actually, like I said, it's the most common, but it can also be the most challenging, is back pain, because it connects to everything. So you can be walking differently, you can shut down muscles and whatnot. And I like to an individual approach to see what caused the pain, what we can do to fix it. Hopefully expedite and get that back to, or get you back quicker, and then restore it so it doesn't happen again. And then vestibular issues are really fun too.
Interesting, such as?
So people come in with vertigo. Most commonly it's from something called BPPV, benign paroxysmal positional vertigo. That's the crystals in your ears.
We'll go with BPPV.
Exactly. And there's not a lot of stuff. So when I was in PT school, and I help teach in PT school now, we don't like to use the F word, as we say it, fix. Okay. But with vestibular issues, we can fix you in one treat. And it's kind of cool because we just have to bring the crystals back where they go, and all of a sudden you're better. So that's really fun every once in a while to see a person that comes in, falling, stumbling because the whole world's spinning, and then all of a sudden we can make them better in one, treatment. So
Wow, wow, that would be wonderful to be just done in one quick thing. Walk
yeah,
in, walk out. Hey, different person. Great
absolutely.
idea there. Now you use a lot of different. I know the modalities, and then outside in the treatment area, there's everything from massage tables and stand or stationary bikes to what all different type of equipment are used out there.
Yeah, so of course, free weights. So that's the big thing. My hands and working on people, that's really good. But the most important thing is teaching patients exercises. That way
Yeah.
you can continue this on your own. In a perfect world, I see you for a few weeks, but I've given you the stuff we need. So we're using free weights, we're using bikes. I use something called a tidal tank that has water that slosh around. My athletes really like that. We have things that are called like blaze pods, which I really like. It almost looks like Simon, where it's blinking on the ground, and I
Oh,
create
interesting.
obstacle courses and stuff for
Okay.
patients
Oh,
to go
neat.
through. So yeah, we keep it fun because most people are coming to therapy, they're in pain. Physical therapy isn't anyone's idea of a good time
Right.
usually, so we can keep it entertaining for them. That's wonderful.
Awesome. Well, I've heard you say many, many times, and I take this to heart that movement is medicine. So the more you move, the better you are. Not only before physical therapy to help keep yourself from having to come to physical therapy, but then afterwards, in whether it be continuing what you've learned in physical therapy or just expanding your movement. Is that correct?
Absolutely.
How'd you happen to come up with that?
We like cliche things, and that stuff sticks, right? So movement is medicine, motion is lotion. I also like to say this one: a plank a day keeps the physical therapist away. So if we can keep
Ah.
your core strong, you can stay away from us, which is good. But yeah, those are the things that people remember, and that's what sticks with us. So we like to use it on people. So
Fantastic. Well, if you ever find yourself in need for a physical therapist, stop by the Hulse Jepson in Granville and see Ben or any of the other number ones. And we hope that today you've learned something, you've enjoyed something. Thanks for joining us, and we'll see you again soon on
see
We
ya.
Live Here, We Love Here, We Work Here, sold by Sonnie. Thanks. Bye
Thank you.
bye.